I would like to move on to our next speaker. Anna Markowitz is an assistant professor of education and information studies at the University of California, Los Angeles. Her work lies at the intersection of developmental science and policy for children and families. Her research focuses on policies to support development during early childhood. For the past 5 years, Dr. Markowitz has been involved in a research policy partnership with the Early Childhood Office in the Louisiana Department of Education. As part of this work, she has helped inform their early care and education policy and support their COVID-19 response. She holds a $1.6 million federal grant to support early care and education policy and practice in Louisiana. She was recently named an Emerging Educational Policy Scholar by the Fordham Institute and American Enterprise Institute, and she was also named an Early Career Fellow in Early Education and Development by the American Educational Research Association. Her presentation, as Dr. Pilars pointed out, will dive into some of the research coming out of Louisiana and Virginia, and will focus on consequences of high turnover in the early care and education field. So thank you for joining us, Dr. Markowitz.
Thanks so much, Mitch, and I will share my screen. Every Zoom call ever, can you see my screen? All right, so like Mitch said, I'm going to be talking about the correlates and consequences of teacher turnover in early care and education settings. Dr. Pilars spoke a lot about the closure of family childcare settings, but I'm going to be talking mostly about teachers who are working in formal classroom-based settings. I'm going to be talking about how even though these center-based sites may not be closing, they are also struggling with instability in ways that should have implications for Wisconsin's children and families and for the sector itself. In particular, I'll be talking about teacher turnover. The sort of high-level takeaways from the talk are that turnover is incredibly prevalent, and it has been for some time, that it has negative consequences, and that unfortunately COVID has likely exacerbated these issues. Just to be clear, because as Dr. Pilars noted, the ECE sector is pretty diverse and there are lots of different places where children go for care. I'll largely be talking about childcare settings here. And childcare settings actually serve a very large number of children aged 0 to 5. So this figure here presents data from 2020 on ECE use in Wisconsin. And this just shows 3 and 4-year-olds, but it kind of gives you a sense. So as you can see, as sort of by design, Wisconsin's 4K program serves many, many 4-year-olds, but also by design, it serves very few 3-year-olds. And certainly no children younger than that. Dr. Pilars showed us that nationally about 60% of 3 and 4-year-olds are in center-based care, as well as about 1/3 of infants and toddlers. While for children under 4, if you're in center-based care, nearly all of them will be in childcare centers. Of course, some are in Head Start settings, but that's a relatively small fraction. Why do parents choose center-based care? Well, some parents may just prefer a center-based setting. They prefer to have their kids get that kind of school practice or socialization with more kids in the room. Some parents may need care in the hours that the centers provide, or just for other reasons. Either way, childcare is sort of fundamentally an important part of the ECE ecosystem, and so I'll largely be looking at that sector in this talk. To echo Dr. Pilars, in these centers, it is the teachers that are caring for and educating these young children that are the most essential ingredient in building high quality. If you've had a young child or been a caregiver for a young child, this may not be all that surprising. I'm sure you can think back to your own kiddos coming home and talking about their teachers and what Miss So-and-so did. You know their teachers can be very important to them. And this is very important because children learn best from adults that they are bonded with. But it actually is more than that. The work of ECE teachers, much like the work of teachers of older children, is highly skilled work that requires specific knowledge and competencies. Teachers create high quality environments by creating warm, sustaining classrooms for children where they're emotionally supported while being challenged intellectually. They build creative and enriching activities that support children as they build the baseline skills that they'll use for the rest of their lives. Teachers are supporting our kiddos as they make their first friends and manage their first fights. And they leverage these tiny instructional moments to help children understand big ideas and gain important new language. Whereas with older children, you can sort of explicitly instruct them or sort of tell them about how to do something. With young children, often you just sort of have to listen to what they're saying and ask them the right question at the right time for them to move on to the next level of understanding. And a high quality educator does this. unfortunately, we lose a lot of these quality building educators each year, particularly in childcare. Now, I'm showing you data here not from Wisconsin, but from Louisiana, and you may be asking why. Well, historically, it's been very difficult to get data on childcare teachers because childcare centers are fundamentally private businesses. Even the question about are there more men in the workforce, this is difficult for us to know in real time because we collect very little data, or we collect very little data that we then leverage for research. There just isn't an easy way to get data on ECE teachers like teachers in the K-12 system. But in Louisiana, as part of a major accountability reform launched in 2012, they have essentially been collecting data in every ECE classroom in sites that receive any public funding. So this would include childcare subsidies twice a year. And this data includes the name of the teacher. And we were able to leverage this to create, for the first time, a statewide data set capable of tracking teacher turnover. And so this is data that we found. So this is annual turnover, and what I have here is turnover from 2018 to 2019, but we've been able to look sort of across several years and see, the same pattern across. Here you can see the rather startlingly high rates of turnover. Nearly 50% of childcare teachers that are there one year are gone the next. As a comparison point here, I have educators in Louisiana's state pre-K settings, which are all school-based. And there you can see that that turnover is about half of what we saw in childcare settings. And just as a further point of comparison, even though pre-K is much lower than childcare, it itself is more than twice the turnover that Louisiana saw in K-12 settings that same year. Now, this is just 1 year of data, but using the same data set, I'm also able to track teacher turnover over time. So I can essentially see if they're working in the same center year after year after year. So on this slide, the green bar again represents childcare centers. The light blue bar represents school-based pre-K. And the sort of y-axis is teacher retention. So my data start in the fall of 2016. So 100% of the teachers that I'm looking at are there. And then sort of as the line goes down, this is our loss of teachers over time. And what we can see here is that after just 3 years, 75% of a cohort of childcare teachers are gone. This is 50% in school-based pre-K. Just to try to add a comparison point to Wisconsin, earlier Dr. Polaris talked about how what percentage of teachers reported that they did not intend to stay at their work, and sort of 25% said, oh, I'm not going to be there next year. So it may be the case that turnover is just higher in Louisiana than it is in Wisconsin. I cannot answer that in these data, unfortunately. But I should note that when we ask teachers that same sort of intent to turnover question in Louisiana, we actually get very similar proportions as Dr. Polaris found. Nonetheless, we're observing actual turnover that's much higher. This to us is suggestive of a pattern where teachers are planning on staying, but something sort of kicks them out of that workforce. And unfortunately, this loss of teachers and really the loss of qualified and competent teachers is massive, particularly cumulatively. It's also the case that this turnover will create challenges for classrooms and for efforts to build ECE quality over time. Turnover creates challenges for childcare centers as private businesses who need stability to operate. Leaders facing high rates of turnover spend much of their time on hiring and managing personnel and rebuilding center climate when it changes when teachers leave. Professional development opportunities that were spent on turning over teachers are lost. So if you spent time developing the skills and abilities of teachers who leave, that's essentially a wasted investment. It also makes it difficult to engage in center-based professional development that brings teachers to the next level because these directors are still focusing on that incoming cohort of teachers. The teachers who are left behind often have to pick up the duties of the leaving teachers, which can exacerbate their own stress and frustration in the work. And then some sites will close down, shut down classrooms mid-year if they don't have a teacher for it, or just serving fewer children than their licensed capacity. And this is sort of the churn that Dr. Polaris alluded to in her talk. Even if we don't see these childcare centers closing, turnover may cause instability within a continuously operating center or prevent centers from operating at full capacity. It's also the case, and this perhaps is not hard to imagine, that turnover has implications for development. As I mentioned earlier, for young children, learning and development really happens fundamentally through trusting relationships. Again, for parents and caregivers, not too surprising. You've seen students get attached to their teachers, and those relationships, particularly for young children, are the backbone of the interactions and activities that teachers leverage for safe exploration for children, for learning, and for development. Children are more likely to engage in activities when they have a relationship with a caregiver that's sort of positive and warm. So children who lose out on these relationships due to teacher turnover essentially lose out on learning time, and they also may struggle to manage the emotions of that loss. They lost a person they cared for, and they don't quite understand why. So you may wonder, how big of a deal is this, or what kind of loss are we talking about here? So what these slides show is the results of a study I did comparing the learning and development of children whose teachers did and did not turn over in Head Start settings, which is another center-based ECE setting. This is data from 3- and 4-year-old children. And what it shows is a clear disadvantage for those who experienced turnover within the year as opposed to children who did not experience within the year. I'm presenting in this figure these negative impacts shown as percent differences. So in my data, children who experienced turnover scored 5% lower on an assessment of vocabulary. They scored 11% lower on an assessment of early literacy, and they had 10% higher behavior problems. The size of these differences is not small. I mean, they may look small on this bar graph that I've made, but to sort of put it in context, these effect sizes are similar to what we see sort of as the academic benefit that you would see if you made class sizes smaller for kindergartners. So a major question is, why are these educators leaving? And unfortunately, evidence on the causes of teacher turnover using rigorous methods is limited, and limited often to small studies in specific locations. And this is limited for the same reason that I'm presenting data from Louisiana today. In most cases, we do not have a data infrastructure that allows us to see teachers over time moving childcare sites or moving from childcare to Head Start. And we certainly don't have exit surveys or other data infrastructure like we see in the K-12 system. That said, we have other evidence that can inform this question. And in particular, substantial evidence showing that ECE teachers face low levels of compensation and sort of corresponding high levels of stress. And these are factors that are linked to burnout and turnover in other job sectors. In national data, the average salary of a childcare teacher is under $27,000 a year. And this is aligned with what Dr. Pallars presented about childcare providers in Wisconsin. She showed that ECE teachers working in center-based settings had a median wage of about $13 an hour, and that only about 20% get access to health insurance from their employer. Now, I just want to note that this also may be a little bit high. So in our data, that median wage is about $10 an hour. Certainly folks in Wisconsin may earn more than those in Louisiana, but Dr. Pallars' data includes all center-based settings. So that would include Head Start and folks who are providing 4K in a community-based setting, whereas mine is just the childcare sector specifically. So the wages tend to be a little bit lower in childcare. This compensation, combined with the challenges and sort of the physical and emotional toil of working with young children each day, does have impacts on the well-being of early educators, which will likely impact their decisions to stay. And I do have data suggesting that the challenges to early educator well-being is substantial. In fact, many children in ECE settings have depressed teachers. Again, I'm showing data from Louisiana, but this time this is data from surveys in several communities across the state. One thing we like to tout about our surveys is that our response rates here are about 80%, which means we are actually getting really nice coverage of the many different folks who are engaging in this work to serve children and families. The bars here show rate of depression using a sort of nationally validated measure. And I have data from 2018, 2019, and 2020, which I'm showing you so you can kind of see the pre-COVID baseline, but then also the spike in depression that corresponded to the arrival of the pandemic. The first thing you should be able to see in this figure is that depression is high. As a comparison point, the horizontal line on the graph is the national rate of depression for women in 2018, which was about 10%. So the average sort of pre-COVID rate was more than twice that in both childcare and in school-based pre-K actually. And then of course, we do see that teachers showed a jump in depression with the arrival of COVID, and our increases were roughly of 30 to 40%. So certainly not trivial. I want to note that my data from Louisiana are not unusual and that other studies have found rates of depression among early educators that are sort of similar. Part of the reason for this depression may be because teachers are struggling with economic anxiety. So, Dr. Pilar showed that our childcare teachers are making less than the average worker in Wisconsin with a high school diploma, and that's going to have certain implications for the value of their dollars. So I'm presenting here data on teachers' food insecurity. Food insecurity is essentially not knowing that you'll be able to access enough food for yourself or your family. Again, the horizontal line here is the national prevalence of food insecurity in 2019, which was about 11%. And I just want to highlight again that these data are from teachers working full-time jobs caring for young children. Prior to the pandemic and during the pandemic, more than 50% of childcare teachers were food insecure. This number was more like a third in school-based settings. Now, this data focuses on food insecurity, but I want to assure you that I'm not cherry picking. In the same survey, 40% of our teachers reported that they struggled to pay their medical bills. Another 60% reported that they struggled with paying off their debt, including debt for education. In fact, about a third of childcare teachers and a fifth of school-based teachers said, look, it's just difficult for me to live on my income in general. One additional note is that this sort of stress and depression is going to have implications for young children, whether teachers leave the classroom or stay in the classroom. That is, there's a lot of evidence that suggests stress and depression affect teachers who are still working in the rooms. We see that stress and depression are associated with lower quality teacher-child interactions, with teacher-child relationships that are characterized with less warmth, and ultimately with increased behavior problems for children. And this is sort of consistent with a body of work on maternal depression as well. The last point that I want to make is that the COVID-19 pandemic did likely exacerbate these issues. There have been many news reports and anecdotes around childcare centers closing due to an inability to staff, anecdotes around parents leaving the workforce that Dr. Pilar's alluded to, in particular because of an inability to find and afford childcare. In the summer of 2021, we collected a statewide survey of providers in Louisiana, and we found that 35% of childcare sites reported that they had at least 25% staff vacancies, and 95%, so nearly all of them, reported that it was challenging to find and hire replacement teachers, and about half reported that they were currently turning away children and families because they were not staffed. I think the voices of the leaders are really helpful here in making some of these points. So one leader said, teacher turnover has created many challenges for us. Losing teachers and finding quality candidates that actually want to work has been our biggest challenge. This hurts our current employees, hurts our enrollment, and can also really negatively affect the children who need stability and routine. A second leader said, I need to be able to pay my teachers a livable wage. It's not fair for them to work so hard but be compensated so little. Many of them are becoming tired of the small checks and are talking about finding other work. Their jobs are important. We are the reason parents are able to go to work or school. I do think this last point is an important one. National data have shown a large loss of women from the workforce over the course of the pandemic. I think in some recent data from September, women had left the workforce at 5 times the rate of men. And recent data from consulting groups have suggested that this problem and the loss of parents in general from the workforce will persist as folks figure out what to do. So in sum, ECE teachers are essential for both the stability of the childcare system and for the learning and development of very young children. Unfortunately, much of this workforce leaves their positions each year, and that has implications for centers, children, and families. The high stress and low wage nature of the work, likely contributes to this turnover, and it certainly is linked to children's experiences at ECE sites. Unfortunately, COVID has exacerbated these ongoing challenges, and returning to baseline is not likely to be a tenable solution. But fortunately, in our next presentation, Dr. Sway is going to talk about what we know about solutions to the problem and the promising strategies that other states are putting forward. Thank you.
Thank you, Dr. Markowitz. Again, we have about 3 minutes for clarifying questions for Dr. Markowitz, and we will prioritize questions from legislators. And just another reminder that you can submit questions throughout the seminar by clicking the Q&A button at the bottom of the screen. So we did have one question come in from Representative Armstrong. He asks, I work with childcare centers weekly. All of the ones that I work with allow workers' children to attend the daycare center at no charge. Has this been figured into any of your studies?
Yeah, thanks. This is a great question. So we do talk to the providers that we work with about whether or not they're able to provide that benefit. Some can and do, and it's one way to sort of attract younger workers and we'll sort of retain them for a longer period of time. Unfortunately, many sites cannot afford to do that, in part for the reasons that Dr. Polaris highlighted. It's actually a huge benefit in terms of cost, right? If you can be getting, that's $15,000 or $20,000 a year, and perhaps even more depending on the age of the child. So some places do that, and it would be a huge benefit, and some are unable to.
I can jump in to add that we asked about this in the survey of the workforce that we did, and we found that about 80% of centers say they offer free or reduced cost care as a benefit to employees. And in our teacher survey, we found that about 38% of teachers say they have kids, at least one child in the household. So, yes, some are definitely likely taking advantage of this. We don't know exactly how many, have kids within the age range that the center serves, but it's definitely a huge benefit for when their kids are, that age, able to attend the center. So it is happening in Wisconsin. We don't know too much details about it though.
Unfortunately, the answer for many of these questions will be the data systems are weak, but we're trying our best.
Thank you both. I think we have time for one more question, maybe a couple. We do have a question from Iva Petrovac. Have childcare costs increased in recent years to combat turnover?
This is also a really good question. So certainly in some places, yes. And if you talk to families, it is becoming increasingly unaffordable. What's really interesting to me is when you work closely with providers, a lot of them talk about how they feel it's their duty to serve in and work for these communities. And so there's a tension between increasing costs and sort of pricing out children and families and being able to pay their providers more. So as Dr. Polaris showed, most sites are walking on a tightrope, and so they'll increase their costs when they have to, but they know that there are some families that they'll no longer be able to serve. And many sites are sort of trying to make sure that whatever they charge in combination with the subsidy rate can be afforded for the families nearby. So there is, a response to the economy, but it's perhaps not as tight as one might think. I don't know if either of the other presenters have something to add to that.
Great. Thank you, Dr. Markowitz. I